Get started. This is Lyle Hanna again. We are delighted you're here. Phase 42. My goodness. We've been doing this for a long time, and we're glad so many of you joined us. We actually had almost 180 people sign up today. So we're at 100. I suspect some more will be coming along. Don't hesitate to look at the chat box. We've got some welcomes in there and some encouragement. If you want to give us some questions, we'd love to have them. If you want to hang on to the end, we'll give you a chance just to talk straight out to us if you want to. We've got a fun day. We're doing this because things have really gotten a little crazy. So the title today is, what's going on with COVID? It is spreading like crazy. So we've got Mark Dougherty, who's going to join us. He's an MD, and many of you have seen him before. He's been on here twice before. And he's the head of infectious disease for the Baptist group. They tell me that beds are filling up. I learned that in the middle of last week, that beds all across the city of Lexington certainly were filling up, and across the state. So we're back at a positivity rate of almost 9%. We got it all the way down to 2%. So there are a lot of crazy things going on. Jim Morris is back with us today. If I could give him a big hand, Jim, we're delighted you're here. And I know you've got some new stuff for us. There's still a lot of things hanging, but we felt like people need to know and give it a chance to ask questions and speak up and share what was going on. So just a couple of words. Let's flip to that next slide. Allison and Autumn and Chase are all going to help us out. And so should be a good day. Before Mark gets on here, I've got a couple of comments, and I don't think Mark signed in quite yet, so we're still looking for him. But then Jim's going to give us the legal update and some regulatory things. I had some notes that I just put down because this is just the reason we're doing this is because the governor's been on again, and he's encouraged additional mandates. He said most of the new cases are coming from unvaccinated individuals, which I think we know. The people that are vaccinated, they said this morning on the news, 99.9% effective at keeping them from losing their lives. But boy, I already have 4 friends that are vaccinated and now have, mild cases of this Delta. So the Delta is really far, far more infectious than the regular COVID. The president has been on. He has changed regulations for all federal workers, saying that they have to be vaccinated unless there's some reason they can't be. And if they aren't vaccinated, they're mandated to wear masks and do weekly testing and maintain distance. A lot of companies have stepped up. Ford Motor Company right in Louisville, big outfit requiring visitors and employees to wear face masks. They're recommending that all team members, unless medically impossible, that they get vaccinated. And anyone that's traveling for them internationally must be vaccinated. So that's kind of interesting. And you're hearing on the news, no vax, no service at restaurants. Shake Shack came out publicly yesterday with a big announcement about it. San Francisco, there's a group of 300 bar owners there who are requiring proof of vaccination or a negative COVID test to enter the bar. You can imagine what kind of difficulty this is creating for people coming in the door and for dealing with customers. So I want to hear from you all about what you're thinking, what you're doing. Allison, do we have a survey ready to go out?
Yes, we do have some polls in the Zoom.
Well, let's go ahead and, unless you're going to save it, let's go ahead and put it out there and get everybody's feedback quickly. And Autumn, can you tell if Dr. Dougherty's joined us yet?
Yes, I'm here.
Yes.
All right. Okay. Well, then we'll move through this quickly, but this will give you a little background, Dr. Dougherty. If people are uncomfortable, you don't have to answer this, but if you've got an answer, I want to see where we are, because we used to be at 80% vaccinated in this group, and I want to see if we've gotten any better on that. And while those are coming in, Dr. Dougherty, we are so delighted to have you here. Thank you for joining us. We'll pull that summary up in just a second for you. But many of you know Dr. Mark Dougherty from here in Lexington, degree from University of Virginia, and several other his medical degrees there from also several other degrees. He has been the epidemiologist for Central Baptist since 1988. He runs the infectious disease group. He has his own consulting practice with about 22 doctors. So he is really out front on this thing. And we just thought we ought to get him on here to talk to us about what the situation is right now. And maybe you've got some recommendations for us about what we ought to be doing going forward. Here are the results. Whoa, we're at 84% vaccinated. So we've got, some percent that are not yet. But that's pretty good. Lexington is the third highest vaccination group in the state. Our sales in Frankfurt are higher than us, but that's a good thing. Our state is in pretty good shape, but boy, wait until you look at the growth of COVID. It's really looking pretty bleak right now. So, Dr. Dougherty, take it away. Tell us what's going on.
Well, first off, I need to correct something. So we have 11 infectious disease doctors in our group, not 22.
Oh, I thought
we're still one of the largest groups in the country, but usually infectious disease groups aren't that big.
Okay.
A month ago, we were feeling pretty good about things. We didn't have to wear a mask indoors to restaurants anymore. The numbers had gone way down. More and more people were getting vaccinated, although not enough, as it ends up. We had gotten down to 3 patients here at Baptist Hospital, Lexington, and no one in the ICU. And that was down from a peak of nearly 100 in the first week of December. That's changed a lot over the last month. So we're now up to 35 patients in the hospital. We have 8 patients in the ICU. And we can see that things aren't looking good right now. We knew that there was going to be a surge again that we were going to have to deal with in the fall. We thought it was going to be primarily in late September and early October is when we usually see what we consider respiratory virus season. We knew that with the children going back to school in person, and that with people going back to work and not social distancing and not masking, and not getting enough people vaccinated, that we were going to see a surge. But the dynamics of the pandemic have changed with Delta. So we know that this was a highly contagious virus before the advent of Delta. At the beginning of the pandemic, when I talked to some virologists, they said, wow, we have patients that we're seeing that have almost no symptoms, and they have the highest viral loads by orders of magnitude than any other viral infection we've ever seen. So that's the Wuhan strain. Now we have Delta that's 1,000 times that. And that changes the dynamics of how many people are getting infected and how many people each contagious person can get infected. So the R naught, or basically the number of people that the average person infected with the Wuhan strain and the other strains, was around 2.5. The CDC thinks that the R naught with the Delta strain is going to be at least 5 and maybe 8 or 9. And if you remember the movie Contagion, that was spreading everywhere because the virus had an R naught of 4. So this is a highly contagious strain. The good news about it is that it's not a vaccine escape mutant. So the thing that we're really concerned about down the road is we can see the dynamics of things here. The virus is constantly mutating. It has a huge chance to mutate because we don't have the pandemic controlled around the world. So there's just a massive amount of virus being produced. And, at some point, we're going to have to deal with other mutants. We just hope that they're not going to be vaccine escape mutants, or at least that we can race and produce even better vaccines that will be active against those. So at this point, the vaccines are still highly active in terms of preventing severe infection requiring hospitalization and death, but not as active as they were against the previous mutants. So we are seeing some patients who've been vaccinated who require hospitalization. I even have one who's on the ventilator. He doesn't have a lot of underlying diseases. He's in his 70s and has diabetes, but most of the patients, more than probably 60 or 70% of the patients who are vaccinated and getting sick enough to come into the hospital are patients who have significant problems with their immune system and just didn't respond to the vaccine appropriately. Now, if you don't have a problem with your immune system, you're not on steroids, chemotherapy, Remicade for rheumatoid arthritis or Crohn's disease, those kind of things, or not a transplant patient, the vast majority of people respond incredibly well, to these vaccines. But we have to be really careful about the immunocompromised patients, and they're going to be really vulnerable going forward. They're not responding as well as we would like to 2 doses of vaccines. I think they're going to need additional boosters. I think we'll have to see, but I think the rest of the population may end up needing to have boosters at some point, but especially the people who are immunocompromised. If we look back at the beginning of last month, we had gotten down to about 13,000 cases of COVID a day in the U.S. In the middle of the month, in the middle of last month, it had gotten to around 40,000, and now we have approaching 80,000 as a 7-day average. We had thought that in October, in late October, the projections from the University of Washington Institute for Healthcare Metrics was estimating that we would be having 160 to maybe 400,000 cases a day then. This was previous projections. I'm talking about 3 or 4 weeks ago. Now it looks like we're going to get to maybe 200,000 a day in 2 weeks. That's going to put a lot of strain on everyone. We know that the states that are getting hit especially hard right now, which is mostly in the Southeast, some in the Mountain West, but especially Florida, Louisiana, Arkansas, Missouri. Those states, well, some of them are reporting, really full hospitals, not enough ICU beds. We got reports from the Hospital Association in Florida in the last couple of days that they're at the highest number of patients in the hospital at any point during the pandemic. We're handling it okay right now, but there's a huge nursing shortage all across the country that's putting everyone under stress, and we can't get back to the situation where we run out of resources and we have trouble taking care of not just the COVID patients, but patients who have other medical problems too. But we think the next 2 to 4 weeks is going to be kind of rough. We're trying to really push everyone to get vaccinated. We wouldn't have this huge problem if everyone was in fact vaccinated. I think the thing that I've realized over the last month is that if you're not vaccinated, you're not only going to have a high chance of getting COVID, you're almost got 100% chance of getting COVID over the next 2 months. This is such a contagious virus. And the other dynamic that's changed is that as opposed to the other strains, people who are vaccinated who get COVID, they can still get COVID and they can pass it on to other people, and they have just as high of viral loads as people who are unvaccinated. So you're going to come across someone, if you're unvaccinated, who is vaccinated, who can pass it on to you, maybe with minimal or no symptoms. That was different than with the other variants that we had before, and that information emerged out of the outbreak in Cape Cod, where 74% of the people who got infected in that large outbreak were vaccinated. Now, the thing to remember about that, if you're still on the fence about getting a vaccine, is that it still, even if you get infected, it still protects you from dying and getting really overwhelmingly ill. So I think that really should take everyone off the fence in terms of getting vaccinated, because if you're worried about the very rare potential serious side effects of the vaccines, you really should be worried instead about getting COVID and the not rare side effects of COVID. As everyone probably knows, we're seeing about 20% of the people that get COVID end up in the hospital, especially if you're unvaccinated. And we're trying to treat with the antiviral remdesivir and the steroid Decadron. That's what we're treating there is the second stage of the illness, so the pneumonitis stage, and that's manifested by the oxygen level going down. We're trying to prevent people from going into the third stage of illness, which is the hyperimmune stage, where the body overreacts to the infections, the lungs can shut down, you end up on the ventilator, or you can die. And then overlapping those two stages is the hypercoagulable state, where you get blood clots in the legs that go to the lungs, and strokes and heart attacks, and the kidneys can shut down and so forth. So everyone thinks about the lungs, but it's really a multi-system illness. It's really sad to see people who I think have been given misinformation and haven't weighed the risks versus the benefits properly in the hospital. And here they're really sick, gasping for breath. We're trying to keep them off the ventilator, and they they just say, I made a mistake. I just made a mistake. I just didn't really understand how bad this really was. So tell your friends and family members, or if you're personally unvaccinated, please get out there and get vaccinated. Now, the other thing that's changed a little bit in the dynamics over the last few weeks is that we know that people who have compromised immune systems, oftentimes don't respond appropriately to vaccines. If you have a normal immune system, you have an excellent chance of developing immunity and not getting severely ill from COVID. But if you've got diabetes, diabetes is not as big a deal. Diabetes and being obese is a risk factor for getting really severely ill. But if you have a transplant in particular, you're going to have a low chance of responding to at least the first 2 doses of the vaccine. We think that people are going to need more doses than that with if they're that immunocompromised. But also people who are on steroids, on treatment for Crohn's disease, ulcerative colitis, rheumatoid arthritis, all of those things, asthma, if you're on steroids for asthma, you're not going to have as good a chance of responding to the vaccine. And your family members need to protect you. They need to get vaccinated, because another thing that I've seen happening here recently is the people in that situation have gotten vaccinated. They didn't respond to the vaccine, and their spouse or someone else in the family didn't get vaccinated, brought it into them, and they're ending up here in the hospital on the ventilator. Really get out there and try to encourage that. I think one of the things that is a little encouraging over the past week or so is we've seen that the states with the highest uptake in vaccines are the states that are getting hit the hardest right now. So some of the states in the Southeast that were really poorly vaccinated before, we're seeing upticks in people getting vaccinated, and I think that's true also in Kentucky. I think one of the other things we're going to see is more involvement with children getting sick from COVID. Now, fortunately, most of the time when children get infected with COVID, they don't get severely ill. There's a small chance of them getting very serious complications from COVID. But I think we're going to see children playing a bigger part in the pandemic over the next couple of months, because we're not doing the remote learning anymore. Kids are going to go in person. A lot of places are not going to mandate masks, which I think is a mistake. And I think that the schools that don't mandate masks, and children 2 and above can wear masks, it's safe. But if they don't mandate masks, then their schools may not be open very long, because we can see from what happened with the summer camps. It goes all over the summer camp. One kid brings it in, and then they all get infected, and then the kids bring it back to their families. So that's another thing that I think is going to be a little bit different now, because last year the kids, for the most part, weren't going to school, and they were social distancing, and that's not going to happen anymore. We're not social distancing like we were. We just at Baptist Lexington, we just changed the visitation policies. Now we're only allowing one visitor per patient. We have to be much more strict about people masking in the hospital. It's been required the whole time, but a lot of people have gotten really lackadaisical about it and thinks it's their right in the hospital to not wear a mask. Well, that's not true. We've got to protect all the patients in the hospital, the health and the healthcare workers too. So that I just right beforehand, I did a couple TV interviews that will be on at noon and then tonight about some of the changes that have happened. Are there any questions that people want to ask? Let's see, I think people went in.
Boy, that was great. There's one on here. You sort of answered this, but how effective from a percentage standpoint is the current vaccine against the Delta variant? I think it's different by different vaccines.
Okay, so yeah, so that's a little bit of a tricky question. So you have to go into a little bit more detail about that. So we know that that part of that depends on what your indications for testing are. And we know that people can be asymptomatic with the infection. So we've had a number of people who we've screened before surgery, no symptoms at all, fully vaccinated. They're infected with COVID and had no symptoms at all. And at first I was thinking, well, with the previous variants, sometimes that was a false positive result, but yet we've seen true positive results with people infected and no symptoms. So if you look at the data from Israel, the vaccines don't look as protective as the vaccine data from the United Kingdom. Why is that? Well, they were using different indications for testing. So in Israel, they were saying that the Pfizer vaccine was only 60 to 65% protective against getting COVID. That's because they were testing asymptomatic people and picking up asymptomatic infections. In England, they weren't testing asymptomatic people, and they were saying that the Pfizer vaccine efficacy had fallen with Delta from the mid 90s down to the mid 80s. But it's important to remember the other dynamic here is that that even vaccinated people now with the Delta variant are getting infected. They may have no symptoms and they can pass it to others. So that's why we really have to emphasize, protection of the compromised patients and compromised family members, and also the people who've decided to not get vaccinated. That's going to be very dangerous for them over the next 2 months.
Wow. Okay. The fact is, it's just confusing because different people have different standards, and we get a lot of communication.
And it depends on what you're talking about in terms of effectiveness. So
yeah.
The main thing that we want to look at in terms of effectiveness is prevention of hospitalization and prevention of death. So those are the two main things. This is the prevention of all infections is secondary. So we think with the vaccines, we think that you can still become infected and that your immune system then reacts and primarily contains the infection to your upper airway, to your nose and pharynx, and helps prevent it from getting down into the lungs and inflaming the lungs.
Okay, so pretty valuable. We've got another question, kind of a comment. They said that people in the medical industry are saying that vaccinated folks are getting blood clots in their legs, even though they have not had COVID. Is that crazy? They want to know if you've heard that. Does that make any sense?
Well, we know that as a rare side effect of some of the vaccines, the J&J vaccine has been a little more tied to this. You can potentially have blood clots. That's very, very rare. And the biggest concern has been blood clots in the brain, because they're obviously, potentially more serious than blood clots in the legs. But we really haven't seen, that may be a little hard to sort out. People get blood clots anyway. I mean, and if we have 50 or 60% of our population vaccinated, then someone comes with a blood clot in their legs and you ask them, hey, did you get a vaccine? Well, half of them are going to have gotten the vaccine. So that's going to be kind of hard to tie that to the vaccine.
Okay, so some people get blood clots anyway.
And we also know that people who are unvaccinated have a very high risk of getting blood clots. And that's one of the serious complications that I've seen of people in their 20s and 30s getting extensive blood clots, and oftentimes in both legs going to the lungs.
Wow. So back to get vaccinated.
At times we've had multiple people in their 20s and 30s in the hospital at any one time with blood clots in their legs that have gone to the lungs.
Okay. Another question about the testing we're doing, just how, we have so many different, it seems like we've got a lot of different kinds of tests going on, and are some of them reliable and some not? And do you feel like we're getting good information, or are there a lot of false positives?
So the antigen tests are not as reliable as the PCR tests. So the really rapid turnaround tests are clearly not as reliable. They're helpful. They're probably helpful in situations where, if you want to say you have a factory that you want to keep up and running, you test someone with an antigen test once a week or twice a week, and a large population to try to keep an outbreak tamped down. The PCR tests are much more reliable. If you have symptoms, you have respiratory symptoms, and you have an antigen test, that's not good enough. You need to go on and get a PCR test if you're symptomatic. Most of the PCR tests that are in use right now are highly reliable. If you have a low incidence of infection in the population, and you test a huge number of people, you may end up with a higher number of false positives than true positives. So when the incidence of infection went way down just a little over a month ago, we were getting quite a few false positives compared to true positives. So we did see that go up, but that's just statistics. I mean, that's just basic statistics. So now most of our tests that are positives are true positive tests. The other thing that's a little tricky about that is that if you've had COVID, you can have a positive PCR test for 3 months or sometimes even more. If it's over, well, it depends on the situation, but if you're non-immunocompromised and it's over 10 days, we're considering that replication incompetent virus, so you can't transmit it to other people. If you're immunocompromised or sick enough to be in the hospital, we're using 20 days as a cutoff, but it's not uncommon to have a positive PCR test for up to 3 months after that. Now, that's not a false positive, that's a true positive, but it's what we term replication incompetent virus. So it's basically devitalized viral remnants.
So you have it, but you can't pass it on.
But you can't pass it on in that situation.
After 20 days is about it.
Well,
Right.
20 days in people who are sick enough to be in the hospital, get steroids, or they have a problem with their immune system. If you're a transplant patient, I mean, it could even be longer than 20 days. But
Yeah.
if you have a normal immune system and you didn't get sick enough to be in the hospital, it's just 10 days. Now, you may test positive after that, but you're not going to transmit it to someone.
Okay, here's an interesting question. If you've already had COVID, is natural immunity just as good as the vaccine?
No. So one of the things that I have been surprised about is I haven't seen as many people get reinfected as I thought were going to get reinfected, but we know, but we have seen some, and I think that number is going to increase with the Delta variant. We don't really know how long immunity lasts at this point. Either from infection or the vaccine. We think that there's some element of immunity for at least 8 or 9 months after you get infected and after the vaccine, probably longer than that. We don't really know for certain what role the humoral immunity plays versus T-cell immunity. So they're two big arms to the immune system. There's humoral immunity, which is antibodies or B cells, and then there's the T-cells, which are cellular immunity. And I personally think that the T-cells are going to end up being as important or maybe more important in long-term immunity than the B cells. So I don't think you can just measure antibody levels and say you're immune or not immune. It's also going to depend on what happens with the T cells. And one of the reasons I say that is that, we know that after vaccination, after the initial dose of the vaccine at 2 weeks, and this holds true of infection too, but at about 2 weeks, you have an antibody response, your antibody levels go up. But you really don't have full protection for 5 or 6 weeks. And that's when T-cell immunity comes into action. So I think that's going to be a much bigger and important factor in durability of immunity than just the antibody levels. We know that in the lab that the immunity that was produced by the previous strains, the Wuhan strain and other strains that came after that, is just not as active in terms of neutralization of the virus when you mix the antibodies with the Delta variant. That's true of the vaccines too, but they have lower activity, but just not, but still some activity. And we know when you measure the antibody levels from people who've been vaccinated, especially with the mRNA vaccines, that they're through the roof. They're sky high. They're higher than with natural infection. So even if you've had natural infection before, it's important for you to go get vaccinated, especially if you've had it several months ago. And the other comment that I'll make there is I think that people who've had natural infection and then get vaccinated probably are the most protective of anyone in the population against getting reinfected, and against not just getting reinfected, but against developing serious consequences of COVID infection.
Wow. Dr. Dougherty, we really appreciate your being here and sharing this with us. Autumn and Allison, did I miss any questions on the list? I see that one about the mortality rate for COVID.
Yeah, that's a little bit hard to answer because we don't know. We have a numerator, but we don't have the best denominator. So when you see the reports like today, if there's 70,000 people in the U.S. that were infected with COVID, we know that's a vast underestimate of how many people were actually infected. There were way more people than that infected, that most of whom didn't have severe symptoms. So we don't know exactly what the denominator is. I think down the road when we get, better estimates on what proportion of the population has already been infected. And then we can look at the numerator of how many people really got sick from it and died. We'll have a better handle on it. The other thing that's tricky about that is not all the mortality that's being attributed to COVID right now that's not the full number of people who are dying from complications of COVID. One of the other things that's happening is you see excess mortality rates in every country compared to prior years. And most of that's going to be attributed to COVID, or at least some of it could be sort of a secondary after effect of COVID. If the hospitals get overwhelmed, you're going to have a higher chance of dying of a heart attack or some other thing, something else, if we don't have enough resources. But a lot of that's going to be attributable to COVID. So we know that the excess mortality in India is in the millions, and that information is going to come out later. We know that some people are dying at home of COVID because some people can't sense their hypoxia. So one of the other things that's been a little bit strange about COVID is some people aren't getting as short of breath as they should be getting, and they're not coming into the hospital and they're dying in their sleep at night. And sometimes that's not going to be attributable. A lot of those won't be attributed to COVID. It's just sudden death at home. So that's a little bit of a tricky question to answer.
Got it. Thank you. There's one more on here. We'll get to that, Dana, your question about the law, and can you ask people if they've been vaccinated?
Well, okay, so let me answer this one question. So what's the end game in COVID? So unfortunately, I don't think I think that what's going to happen is the virus is going to become endemic. You know, we're going to have to deal with COVID, you know, probably forever. There's going to be different variants that come along. We'll have to readjust the vaccines, just like we do every year with flu. And I don't know if it's going to be an annual vaccine. It wouldn't be surprising if it was annual, or every couple, maybe every 2 or 3 years. We just don't know yet because we don't know how durable the vaccines are.
Yeah.
But I think we're going to be dealing with COVID for the foreseeable future. But that's what's happened with the other coronaviruses. Now, the other 4 that were circulating continually before this, we think at some point that those appeared on the horizon. They probably there's one that probably caused a big outbreak, OC43, in the 1890s, and caused a lot of deaths then. And then a lot of people, developed immunity to it, and we get sick from it now. People get sick each year, but not critically ill like they did when it first appeared. And so that same thing's probably going to happen with COVID. The thing that we're really concerned about is that the epidemic is so massive, with so many people globally getting it, that and the viral load is so high that there's just so many more viral particles out there than there have been with any other viral infection. It gives the virus that much more chance to develop nasty, aggressive mutations. And we're concerned about the advent of a vaccine escape mutant that will be even more difficult and more deadly. That hasn't happened yet, but what do we need to do about it? We need to get everyone in the whole world vaccinated. So it's not just the U.S. If the U.S. doesn't help even more, we have helped quite a bit, but if we don't help even more in getting the rest of the world vaccinated, not only are they going to have the consequences, but it'll come back on us. And that's what we see happening with Delta. Delta came from India, and now we're having to deal with it here.
All right. Hey, it's awesome to have you in our community. We're so lucky to have your talent going to work for all of us every day, and we're doing everything we can to get people vaccinated. Just thank you very much for joining us today.
Well, let me say, someone asked a question about mandatory vaccination. So, I think that it should be mandatory for all healthcare workers to be vaccinated. It's mandatory for all healthcare workers to be vaccinated here against influenza. These vaccines are way more effective than the influenza vaccines are, and it's a disease that's substantially more deadly than influenza. So I think we need to push ahead. I don't know if it can be done on what level, on the state level or federal level, but I think we really need to push for mandatory vaccination. That is somewhat difficult when the FDA has not fully approved the vaccine, in my mind. And I think it should be fully approved. I think the FDA is sitting on their hands, and they need to get a move on. I've talked to our representatives in Congress. you know, they don't have that much leverage over the FDA because it's an independent agency. But there's absolutely no way in the world they're not going to approve these vaccines. Hundreds of millions of people have received them already. The vaccines have proven themselves, and I don't really understand why they're delaying things so much. But I think if it gets to, I thought frankly they were going to be approved in July. The FDA came out and said, well, they're expediting it, and they'll have it approved or have their decision made by January. I mean, that's not expeditious in my mind at all. And I think they just need to get a move on and get the vaccines approved. And I think that will encourage some people who are saying that, well, they're investigational, experimental, and so forth to proceed. And it does make it easier, I think, for businesses and government organizations to mandate the vaccines. So, okay, I'm sorry.
No, that's awesome. I'm so glad you just,
on that.
I was trying to hurry because I know you've got patience. You got things going on.
Yeah. Okay.
So,
well, I appreciate it. Okay.
Thank you
Well,
very
thanks,
much
everyone.
for joining us.
Okay. All righty. Bye-bye.
Have a great day, and yeah, stay COVID free.
Okay. Okay. I'll see you.
All right. And thanks to everybody on this call for asking so many good questions there. That's really helpful. That's great. And Jim was going to try to wrap this up by noon, but I'm not sure you can do it that fast. But Jim, let's hop on it. I know you've got a lot of great things to share. Keep the questions coming in. This is why we did this, because we knew there was just there are a lot of unknowns. So Jim,
so
needs no introduction. You guys done an awesome job for a year and a half now. Let us have it.
All right. So first, I'm sorry to those that thought last week was so much better than anything I've ever done and wanted Tyler back. It's just me. Tyler filled in last week. I had a meeting. I'm still stuck down in Key West, Florida. I know you feel really bad for me. I grabbed the least Jimmy Buffett shirt I could find, and that's what I'm wearing. But last week, when all this started to fall apart, I sent a note to Lyle and said, we've got to get on top of this, and I think everybody needs to have, if we're going to do this, this is the time you all need the guidance, so that's why we're here. So the CDC came out with its guidance on the 27th. I immediately sent a note out and said, this is the biggest update we've had in a year, and it's going to change a lot of things. For those that don't know, it's a reversal of course, issued a mask guidance for fully vaccinated up until the 27th. You're fully vaccinated, you don't need to have anything. They went on the idea that vaccination, in order to increase vaccinations, they were giving us some freedom, but then they came back and said, you need to wear them indoors in a substantial or high risk area of transmission. Moderate and low, you don't have to. Well, there's a lot of confusion because they really didn't say what substantial or high risk was in their announcement. We're going to get to where they identified what it was. Certainly immunocompromised, anyone who has health issues or anyone who has a potential of getting COVID at a higher rate needs to wear masks indoors, regardless of the transmission risk level. As the doctor just indicated, you're looking at a situation right now where this is more contagious, this particular variant, than the cold, the common cold, or any of the other diseases you're used to getting annually, the flu, the cold, the sniffles, whatever you want to call it. This is far more compromising, far more contagious than anything else we've ever seen before. So then the CDC also said fully vaccinated who have a known or suspected exposure are supposed to also be tested and wear a mask until they receive a negative test, recommending universal indoor for all students, teachers, and so on. And so then multiple states and municipalities have made wholesale changes. In Kentucky, now this was as of Friday night or Saturday, because things are changing so quick. I tried to keep these updated, but all but 23 of Kentucky's counties fell under this new CDC guidance for mask mandate or mask guidance and recommendations. So what does it mean? And I wanted to pull this because if you don't know where to look for it, it's almost impossible to find it. So low transmission, the CDC says that's between 0 and 100 on a, 0 and 10 on 100,000 person over a rolling 7-day average. Moderate is between 10 and, I'm not going to do a partial person, 0 to 10, 10 to 50, 50 to 100, and over 100. That's how I'm going to explain it to you. So what they're focusing on is the substantial and the high transmission area, the above 50, above 100. So this is the map, and this is as of this morning. This is available on the CDC website, and I'm going to pull those down and show those to you here in just a second, some of the areas where I'm giving my information. The problem is the blue areas that you see, well, my mouse, I'm not going to be able to use my mouse because I don't have it. So in the middle of the country, there's a lot of blue areas. And so you look at it and go, wow, there's some areas that have very low incidence. The problem is a lot of those areas are uninhabitable. There is no population or no reporting from those areas. Some of those are Bureau of Indian Affairs lands where they just are holding them for Native American reservations, or they are government owned, so there's no land to be looking at. So the vast majority of the country then, if you look at that, is all orange, all red, or yellow. The interesting thing of this is if you look back 2 months, it was the exact opposite. So the question has been raised, is this real? Are we really impacting this at all by any of our actions? And I'm not trying to be political, and I will not get into any of that other than it's remarkable that Pennsylvania, New York, Vermont, Connecticut, Massachusetts and Michigan were like ridiculous hotspots. Now they're not. The ones that weren't hotspots, now they are. Basically, it's going to work its way through, and there's nothing we can do to stop it from getting its way through. We're trying to tamp it down. We're trying to make sure that the impact of the COVID illness does not have the same impact on people as it did when people were dying at the very beginning of this pandemic. So that's what we're focused on, is trying to minimize the impact, not necessarily that you'll get the Delta variant or anything else, but how do we stop you from dying once you get it? So the mask requirements across the country have come in. And let me make sure I didn't skip. No, okay. So if this is important to you, I'm going to rattle this off very quickly. First of all, unvaccinated, that is a nationwide requirement. Almost every single state says if you're not vaccinated, you must wear a mask. Every single state has the transit. What that is public transit has a federal component because of the CDL license, commercial driver's licenses for buses, the taxi registrations, Uber and Lyft being federally monitored now, airplanes, interstate travel, all those different things. You have to wear a mask. High risk areas, we're talking about hospitals, medical centers, detention facilities, homeless shelters, almost universal across the entire country with those as well. So what I did is I broke it down by states: California, Colorado, Kansas, Massachusetts, New Mexico, Oregon, Puerto Rico, and Vermont. They have a requirement for all unvaccinated, all transport, all medical, all detention, all high-risk areas. Then Connecticut and New York are requiring that any CDC recommended public place must be followed. The reason why you're hearing all these things is, stay tuned. I think I told you April of last year. From what I could tell, our governor was following New York. So he hinted at this in one of his mask guidance. So when he said we're going to follow CDC recommendations in one of his mask guidances and in his mask mandate, there is a mask mandate in place for the state of Kentucky. He referenced following CDC guidelines. So I put Connecticut and New York on there because I truly believe that's where we are headed. There is no indication yet that he's going to do it, but just keep that one in mind. The other one is kind of what Kentucky's doing, which is right now DC and Delaware requiring it for all government buildings, That's what where we are right now, plus healthcare, homeless, so on and so forth. Hawaii, all indoor places. Illinois, this was the crazy one, because if you're trying to just follow, quote, required compliance with CDC recommendations, it's a daily change. So there's no way to stay up with the CDC recommendations, but yet that's what they've done. Maine limited it to the CDC elevated counties. Maryland has one county. Nevada's all masks indoors in any county that's a high risk. That does include Vegas and Reno. North Carolina, Ohio, and Washington had an interesting approach, which is theirs is mandated school and children-related activities. I put the asterisks at the bottom. If this is important to any of your interstate travel for your employees, or if this is important because you're a multi-state facility, please make sure to look at each state or obtain specific guidance, because as I was doing this morning, 2 states changed this morning. So it was absolutely impossible for me to keep doing things state by state. So Kentucky's changed status. 2 months ago, I didn't include it because I didn't need to. Honestly, we stopped putting this on the screen. I talked to Lyle and his group about it, and I was like, hey, COVID's pretty much done. Let's not put it on the screen. Let's not keep drumming COVID. You all heard that. We started to switch to once a month with other activities like the Great Resignation. We did that on purpose because we don't want to scare you if we don't have to. And the state was green and yellow with, I think, 1 or 2 counties that were red, and they were very sparsely populated counties. Now you look at it and we are almost back to vast majority red. All of them but a few are in the substantial or critical areas for the CDC guidelines. And when I wrote that about Friday, where we were at a situation and it was, I believe it was 23 counties, I think it's down to 12 counties that don't meet the CDC guidelines. So that's how quickly this is changing. So Kentucky came out, and this is important for anybody that has a business in a red zone reduction. It is a recommendation, but there was a little jab by the governor to schools, which foretells a little bit of a problem for businesses. So just keep this in mind. There's a recommendation, not a mandate, for red zone counties. It has changed from what it was before, so I put it on here. Red zone counties are supposed to increase vaccination, encourage masking, encourage social distancing, encourage medically vulnerable people not to be around others, consider postponing large public events, and encourage community partners and stakeholders to implement a strong communication plan. Not yet threatening, not yet scaring, but if you're a business and you're in a red zone county, can you get sued for not having, I know we talked about all the statutes trying to protect you, but that was as long as you were following all of the appropriate guidelines and recommendations, and your business then accidentally exposed somebody to COVID. So these red zone recommendations are telling you slow down, keep people separate, encouraging a lot of changes. How does that impact you on a legal challenge if you're sued because you run a restaurant and somebody gets sick? Right now, I think you're okay, but you need to be careful because I can see this changing very quickly, very soon. I suspect we're going to have a call today. The governor has a call this afternoon at 4 o'clock. I believe you've got some more mask mandates coming or mask guidance. I believe you're going to see a lot of changes in the next couple of days because people are literally trying to keep up with this. These things happened on Friday. Wednesday was the first CDC. Friday was the governor's mandate and guidance. School mandate came out Friday afternoon. This is like brand new. We're here on a Monday morning and things are drastically changing by the minute. So, mask requirements in Kentucky. I want to take you back in just a second, or just a little bit, so that I can put you back to where we are, because this is kind of why we stopped at the end of May with any COVID updates, other than, like Tyler last week did a quick update for you on COVID. I did one last month for you on COVID, but it was literally just a, hey, here are the little tweaks just to be aware of. On the 11th, the governor lifted all mask mandates statewide, with the exception, of course, of certain health facilities, detention facilities, homeless facilities, and so on. Public transportation is outside of his purview. That is a federal mandate, and that's why you still have to wear masks on transportation. July 19th, it started to come back in. The governor issued mask guidance, and that's what Lyle spoke about at the beginning. This was the mask guidance that was pushed out. This is when Ford originally said, we're not going to do it, no mask mandate. They did one in Missouri, they did one in Michigan in response to mandates, but they said in Kentucky at the Ford facilities, we're not going to change. That was the 19th. So the guidance came out and said, all unvaccinated, you must wear your mask. If you're high risk, not must, should wear your mask. If you're vaccinated, you didn't have to, unless you're in a job or at a position where it's a very high risk, then you should. Everything was should. On the 27th, there was a mask mandate, and this is a true mask mandate. It is the governor issuing one for all executive buildings. Now, this has been published as a government-wide mandate. It's interesting, though, because if you look into certain government buildings, even within the same building, you have to wear a mask, and you'll see I shouldn't jump forward, but you have to wear a mask in one room, but not in another room in the same government building. We'll explain that here in a second. But on the 27th, mask mandate, all government buildings. It technically is not, it's all executive branch buildings only, not judicial, not legislative. So if any of your local facilities fall under one of those, it does not require a mask unless the local or the other branch of government has required it as well. Then it said that all healthcare facilities, anyone who tested positive in the last 10 days or anyone who has exhibited symptoms in the last 10 days are required to wear a mask. That was the 27th. Then said we're going to follow all CDC guidelines. This is where I'm cautioning you to kind of look at what New York is doing, because that's why I say I think it's coming, because that's how New York got their indoor mask requirement. Is they said, we're going to follow the CDC guidelines and recommendations, therefore all indoor facilities. Just keep this in mind. I think you're going to see it this afternoon. I don't believe that the governor got advance notice from the CDC, so it's taking a weekend to try to put together his team to figure out the right way to do this with the new limitations, because remember, legislature came in and said he could not do certain things with his executive orders. So he could not do the sweeping mask mandate like he did before. He only can do it for 30 days. He has to spell things out, and he has to do it very carefully, or it's now void under the new legislative initiatives. So that's why I think it took a little bit longer. On the 29th, the governor issued, and his team, and I say that because it came out from it came out from the Health and Family Services, it came out from a couple of other Kentucky Healthy Initiative. There were a few different groups he used. On the 29th, he came out with guidance for the schools. That guidance requested that the schools adopt indoor mask mandates and other procedures. Down here, this is where I was talking about the confusion and some of the problems. Various state agencies are rejecting his mask guidance, mask mandate, and they've gone a different direction, or they simply are not required to implement the governor's mask mandate. There was a judge at a local facility or a local courthouse in northern Kentucky that was asked about why he and his staff were not required to wear a mask when the people at the front entrance who were the security force were, and why the driver's license in the same building had to, but not him. And the answer was, because I'm in the judicial branch, the executive branch can't tell us what to do. We have to follow what the chief Supreme Court justice tells us what to do. We can't follow the legislative or the executive. Legislative came out, same thing. Several State entities, state elected officials have rejected it as well. This is going to get really confusing in the next few days and weeks because certain individuals, certain groups are now saying the governor no longer has the authority. So that's why it's taken longer for him to do it. And that's why you're going to see a ridiculous amount of confusion after he does it as to whether it can be enforced by the different groups. So that's why I told you down there it applies to executive, not the judicial and legislative. Municipal buildings, room to room. So the recommendation is carry your mask with you because you may be required to take it, put it on in one, and possibly take it off, not mandatorily, take it off in another. Fayette County has not yet announced anything with regard to its offices. Louisville came out on Saturday with a directive that theirs and all Metro-owned vehicles that are carrying 2 or more employees must wear their masks at all times. So that's the new issue in Kentucky. All right. So
Okay, Jim.
I wanted to talk about this. Yes.
Keep it rolling. I wanted you to see I put on my mask. You never know who's creeping up around you, do you? Sorry.
That's
Keep
right.
it rolling.
So and Lyle's at work right now, and I called the police and asked to have him arrested for not wearing it. So now, if you're in your own cubicle, remember we gave that guidance back in like March or April of this year. It says now it's not yet required, just recommended unless your business requires it. So the school, I've had a lot of questions about the school, and I know this may not impact your business, but this does impact a lot of you with your children. And I do have a lot of public school people that show up on this to get information. On the 29th, the governor recommended the mask mandate in public schools. It's not currently a mandate. It's a recommendation for a mandate. Then he followed up, and this was the biting thing that I'm a little troubled by. He followed up and he said, those districts who choose not to follow the CDC guidelines may face liability, quarantine, and forfeiture of all athletic events. That troubles me because I don't know that he has authority, which is why everything we've done so far, if you look at our COVID-19 page for Kentucky, it has all of his activities as an executive, and then he refers you to the Kentucky Department of Education for the education-related limitations. He refers you to KHSAA for all of the athletic-related limitations. But this time, the threat of liability troubles me because they do have immunity from a lawsuit. They don't typically get sued for doing things as long as they don't do it, or if they do it in a reckless, without thought, so on and so forth, but they typically have immunity. So that's where I said I'm concerned, because I think I can see that getting beyond the schools to the businesses, to what you're doing on a day-to-day. Are you jeopardizing your employees and so on? Because he literally said, if you don't do this, you may face liability, and that's to his own school system. So in response to the recommendations, same exact time, the Kentucky Health and Family Services issued new guidance to the schools. They recommended, these are the main things. If you need to see it, I'm going to show you that here in a minute. Vaccination for those who are 12 and older. Masks for all persons. Now, keep in mind that includes your pre-K, your kindergarten, first and second graders, which were not included previously. Social distancing of at least 3 feet instead of 6. Screening testing for all unvaccinated individuals, which then, to the answer to the question on the left-hand side of mine, at least in the chat, can they require a proof of vaccination? The answer for the schools apparently is yes, because they are literally doing it. And they're literally being recommended to do that. Ventilation, hand washing, facility disinfection, isolation, quarantine, and contact tracing, those are all same as they have been. That same date, the Kentucky Department, this is Friday, Thursday. The Kentucky Department of Education published the Kentucky Health Family Services recommendation on the KDE website. Didn't say it's the law, didn't say they adopted it. But in their news and information, they dumped it in as something that everybody needs to look at with regard to COVID. I don't know what that means, because have you adopted it or have you not? Are you just putting it there for information, or is this now the rule? It's on their COVID information for the Kentucky Department of Education, but they have not adopted it officially because they have a group that has to actually approve it. But I suspect it's going to happen. It's going to happen very quickly, so stay tuned on that as well. The other thing is, I put it down there. I know it's out of date. It's the July 17th. If it's important to you, KHSAA came out with a new guideline on the 17th about how to get back to normal for sports. Clearly, that's outdated because it's more than 2 weeks old. It's crazy to say that, but if it wasn't issued this week, it's going to be revamped. So please, please don't rely on the KHSAA guidance that is 2 weeks before the variant announcement by the CDC and the KDE and the governor's recommendation. I believe this is going to have drastic impact on football, upcoming fall sports, various activities in the K through 12. So just keep that in mind. Couple of things here. Fayette County has not yet announced. I looked it up this morning. They still have on there that the governor has adopted this other lifting of the mask mandate on June 11th. But they do have something, and I can't remember whether I put it in here, and if I didn't, I'm going to pull it up and show it to you. They have a sliding scale on their website. I don't know about everybody else's, but Fayette County has a sliding scale, and right now it's one number on a 7-day rolling average below their red zone. So we're in the orange, which is in person, but recommending potential remote for anybody who is at risk. One more number up, 84. Right now, I think it's an 83. If we get to an 84, Fayette County rolls over to a partial remote, partial in person, and they have their whole policy spelled out with a gradient scale of low up to purple instead of red, and the purple is above 100, and it is mandatory 0 in person, all remote learning. So we're at an 83, 100 is mandatory, all remote. If what the doctor said is true, we're probably in the next week or two going to be into the red, if not into the purple, and who knows what that means for opening of schools in 2 weeks. So the Murray Independent, somebody said they postponed the start of school and they're following the mask recommendation. I apologize, this was last night or yesterday. Ballard and Murray issued an announcement saying they would not follow the current mask mandate recommendation. But I did say on there, stay tuned, because I knew that this is all so fluid. They'll get pressure. People will meet as a board. They'll flip-flop on it because nobody can keep up with what's going on. So I want to cover the DOJ. One of the biggest questions I got last week, and ironically, this was, Lyle, I think you'd agree, this was before CDC came out with this new critical mask update recommendation and so on. Biggest question I was getting last week was, can we mandate vaccination?
Yep.
Who all is mandating vaccination? Can we mandate masks? Who all is mandating masks? Those are the two biggest questions that we were getting. Could we get examples of other programs or other big employers? Can you identify some of the ones that are actually doing mask mandates again? Can you identify ones that are mandating vaccination? The answer came out from the Department of Justice. They have declared federal law does not allow public agencies and private businesses to require vaccination as a condition of employment. Let me rephrase that. The federal law does allow, to require, I said does not, does allow the vaccination as a condition of employment. You cannot prohibit public and private entities from imposing it, even when the only vaccinations are those that are not even authorized yet. So the DOJ has come out and said, as part of the vaccination effort, employers can do this. I brought to you 2 months ago, I think, the Texas case where there was a hospital and certain people said they didn't want to be vaccinated working at a hospital. They sued because they were getting fired. The hospital challenged it. The federal court said, no, you can require vaccinations. Now the DOJ has stepped in and said you can require vaccinations. Veterans Affairs, California, New York City, some or all of their employees are being required to be vaccinated. If they're not vaccinated, they have to be tested all the time. Remember what I told you in April. I think it was April. There are 2 absolute prohibitions to a mandatory vaccination. 1, people with disabilities. 2, people who say that they have a religious belief against the vaccination. Remember, the religious belief is not a recognized religion, is not a mandatory religion. It literally is an individual's religious belief. If they have a firmly held belief that they should not take this for any spiritual reason or the absence of any spiritual reason, they don't have to take it. So it's a very slippery slope when you start threatening people with vaccination. Make sure you have a policy written that says, at the same time, you don't have to take this if you have a seriously held religious belief or you have any kind of potential disability, any kind of potential harm that could happen from taking the vaccine. In other words, don't go out on a limb because you don't want to be the first one sued on COVID, calling me up going, okay, how do I get out of this because I'm getting sued by an employee who claimed that they had a religious belief and I laughed at him and thought it wasn't real. And the reality is any religious belief you can't laugh at. You have to let them have that belief. So be very careful. Vaccine mandates. They're on the rise. American Medical Association, American Nursing Association, the American Academy of Pediatrics, the Association of American Medical Colleges, and the National Association for Home Care and Hospice. They're all supporting mandatory vaccinations for all healthcare workers. There are varying recommendations for the targeted population. There's all kinds of confusing guidance out there. Lay back. Listen to what's going to happen this afternoon with the governor. Listen to what main businesses are doing because they have teams of legal experts telling them what to do. Follow one of those until you can craft one for yourself. The next several days are going to be very difficult. When we scheduled this on Friday, I really truly was hoping that we would get more updates on Friday, Saturday, Sunday from our government. We did not. We don't have the ability to tell them to hurry up and get things out there. So we are struggling to get you the information as quickly as we can. Couple of things. I haven't been able to read the chat because I don't have a keyboard. I don't have a mouse. So I'm a little bit lagging behind here.
Well, Jim, let me
just say this. Hold on just a second, Lyle. Let me just say this. You can require proof of vaccination because you're helping to protect the health, safety, and welfare of the rest of your population. If somebody doesn't have a vaccine, remember you have to reasonably accommodate them. Separate rooms, plexiglass, work from home, all those things are available. We've talked about those for months. Those still exist. Nothing has changed. If anything, it's gotten more lenient on your ability to ask and follow up because the DOJ has now stepped in. Yes, Lyle, I'm sorry to interrupt.
No, that's great. I just wanted you to know that Dr. Keith Knapp's on here. He's spoken to us before, and he sent out a really good article. And I looked for this last night, but couldn't find it. So it's an ABC News report, and it does just what you said. Look at what other people are doing. So it gives this great list of like Disney and Google and Facebook and Netflix and Morgan Stanley and even Delta Airlines. I bet they wish this new COVID wasn't called Delta. But anyway, they've all put out, you got to be here. Sorry. If you're going to come in this office, you got to be vaccinated. And they're asking for proof of vaccination. So a lot of big organizations have stepped up over the weekend and said, forget it. We're asking for it. We're mandating it.
Yep.
I'm
copying I'm copying a few things to put in there. Kentucky-based, guys. I'm doing this because I know we have more Kentucky than anything else. The first one, though, is the CDC tracker by county. If it's important to you, pull it up. The other one is the KDE, the Cabinet for Health and Family Services, Health and Family Services, the KHSAA, and the Gov Status, which is the KY COVID. All of these are the ones that are your current information. To the question that Jane just asked, yes, employers can ask if current employees are vaccinated. That was something that we talked about before. Nothing has changed. You can still ask about whether your employees are vaccinated. The level of proof that you require, you're supposed to be lenient with forcing a specific letter from the doctor, because that may impact the doctor, slow them down, and so on. So if they have a vaccination card, if they tell you, yes, I've been fully vaccinated, you can rely on them saying that. But yes, you are legally entitled to ask current employees. And if I've missed anything else, roll through them. I'll do the best I can.
So there's one question: if a company requires vaccinations and an employee has an adverse reaction to the vaccine, is the company liable?
That's a great question. You could end up being responsible. They did build into the January COVID relief bill, they built into that some relief for people who were getting vaccinated and are ill as a result. You have the ability to give them time off under the EFMLEA. But the question as to whether they have an adverse reaction and something more serious happens, there's a lot of questions out there about who's going to be responsible for it. I think you're going to be pretty well covered on immunity, because you've got the government telling you, yes, you can require vaccinations. Yes, it's a health concern. So you're following the guidelines of the CDC. I think you're going to have the ability to protect yourself through that. Now, can you still get sued? You most certainly can. And that's the concern. And I did see there's a comment from Rebecca about the tracker mask. It looks very different. They're using different standards and different counting. And it is amazing how much different they are. And there's not much that you can do, because it is, it's a CDC, and people are trapped into whether they're going to follow it or not. I mean, it's kind of so this is the mapping, and I was trying to zoom in on it. They do still carry down here the Paducah area, where there's 2 counties that are blue, and on ours they're green. If I zoom in too far, it'll just go off the screen, but you can see right there. And if we did it by county, it would show up with a better area for us to be able, but I can't zoom in. So if I do that, it just messes it up. Wow, 4 new messages.
Yeah, we got a couple new questions. Can employers divulge to their entire pool of employees who is not vaccinated?
No.
Yep, fair enough.
So the concern here is you have to reasonably accommodate. If you have employees who, for an ADA reason or religious basis, are not vaccinated, but you're requiring vaccination, if you start putting that out there, you run the risk of exposing a HIPAA-related or a religious-related. Your best bet is to simply treat them with the appropriate level of concern, separate rooms, work from home. Chances are people are going to be able to tell who, the masks, all those different things.
You still can mandate masks.
I'm sorry?
Yeah, you can still mandate masks.
Right. So basically what you're doing is you're going to tell by actions, not by saying this guy hasn't gotten vaccinated. You have to be very careful to say, Lyle Hannah has not been vaccinated. You could just say, please respect the plexiglass in the separate rooms. We have need to protect people from this. So you kind of just don't say it, but everybody will know by those that are remote working or plexiglass or separate rooms.
Kind of related to that, we had a question from a nursing home. Many of our partnering nursing homes have asked about the vaccine status of our healthcare employees that entered their facilities to care for patients. Do we need to obtain authorization from the employee to share their vaccination information with the partner?
If it is, it sounds like a temp staff agency that probably is doing like the home health or the non-CNA home health people. If it is a separate, let me back up. If you have a contract when you hire them that you are the joint employer, the answer is possibly. If they are truly an independent group and you're taking a group of, let's say, CNAs and going into a healthcare facility and you are working as a separate vendor, you have to have the permission from your employees to share that information, because that is not your employer of record. You're doing that to a third-party vendor. Now, you're getting into a lot of legal issues, and that's broad-based, not specific guidance, because I can't give you specific guidance without knowing all the details, but that's where you run into trouble, and you could be violating employees' privacy rights because you're not properly getting legal guidance before you do so. That's like right there on the border of what I can't help you with. That's why I hesitated for a second. The comment about the lime green bracelet and the others have to wear masks, probably not appropriate, because what you're basically doing is giving them a scarlet letter saying these are the people who are, for whatever reason, not vaccinated. You have to be careful with it. You have the ability to require masks. You have the ability to require vaccinations. But for those that can't, for whatever reason, if you're basically singling them out, you're basically telling everybody else, hey, look, Lyle Hanna, there's something wrong with him. ADA or religious, he's not gotten vaccinated. He's not wearing the lime green bracelet. Now, I will tell you this. We had a meeting this week, like I told you, in Key West, large group of people, because of concerns over the Delta variant and health-related issues. 2 people couldn't be here. The rest of the people that were here, we bought bracelets. We did not mandate, but we bought bracelets, green, yellow, and red. And we had them laying out, and people were allowed to identify themselves, or they didn't have to at all. Their choice. I've seen it done with lanyards as well. Yellow, red, green lanyard. You don't have to do it if you don't want to. There's no mandate to do it. But if you want to voluntarily identify yourself, you may. But if you start requiring it as an employer, or even if you're highly encouraging it, and lime green is being worn by all of the free people, but the other ones are all being forced to wear masks, it could get into people feeling like they're being threatened inappropriately. Just be careful.
All right. Wow, great questions and great input, Jim. Thank you very much. It's a hot topic.
Hey Lyle, that last comment I want to point out. Somebody said, so those who are vaccinated are not required to wear a mask. Everyone else has to wear masks, so everybody knows. That's just literally common sense, but the employer is doing that at the CDC's recommendations. The employer is doing that based upon current governor's recommendations. If people can logically figure out who's not vaccinated by the fact that they're all wearing masks, that's not the employer's fault. But if you're sitting there going, wear a red bracelet if you're refusing to get vaccinated or because of your health condition, wear green if you're not, that's going to get you into trouble. So if they can logically figure it out on their own, that's great. That's not your fault. If you're the one doing it, then it's an employer mandate and you run the risk of getting into trouble. That's all. The funny thing, this is a great question. I'm going to throw it out there too, Lyle. As long as we keep getting questions, I'm going to answer them.
Yeah, good.
Neely's question Neely's question about the religious belief, what kind of documentation can you require? Go back to February when I covered the brand new religious discrimination guidelines from the EEOC. Honestly, you can't require anything because it is the presence of a belief in God or more than one God, the absence of belief in any God or multiple gods, your own personal closely held belief in a God or a lack of a God, or your own personally held belief in something you strongly believe in. And if that just made your head go, it should, because literally religious discrimination is anything that any individual wants to believe strongly. You can't challenge them as the employer because it doesn't even have to be, for example, they could be Presbyterian or Methodist, and the Presbyterian church is going, whoa, 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 we have no mask requirement guidelines, we have no vaccination position, we're not telling you to do or not do. But they themselves can say, as part of my Presbyterian belief, I personally believe I shouldn't have to get the vaccine. That becomes a religious belief and you can't do anything about it. It is the most, if your employees are listening to this, and I hope they're not, it is the most crazy thing for them to be able to use, because all they have to say is, I have a closely held belief, and you have to go, uh-oh, that's religion. And then you're stuck with it. Wait, somebody just said, yeah, no, he's saying New York issued a mask mandate. New York did issue a mask mandate. Their mask mandate, though, was not across the board. Let me see if I can put it on the screen. Their mask mandate was, and I quote, and it's right here. Whoops, where is it? It's required for fully vaccinated in school, not broad-based, and they're going to follow any CDC recommended public space. That doesn't have any definition because the CDC doesn't really talk about public space indoor, but they say they're going to follow it. So that's what I'm saying, is it's like all over the map. They're issuing but not issuing. They're announcing, they're not. Everything is bouncing around. So the different sources are saying different things, but that's why we put on the screen, Connecticut and New York were fully vaccinated in school must wear a mask. That's as far as they've gone with a mask mandate. I believe New York City said in municipal buildings, but I didn't put it on here because it's just New York City. But this is going to change literally hour by hour. So just watch the big organizations in those states. Watch what Lexmark does. Watch what Keeneland does. Watch what the Ford plant in Louisville does. Watch what GE does. We're going to be posting on our website the things that we can keep up with. The problem with doing a blog right now is by the time I get the blog done, it's outdated. So I recommend heavily that you kind of look at the big boys, see what they're doing, and for right now, sit back and don't try to create your own new way. Do something somebody else is doing, because chances are by tomorrow, you're going to get more guidelines. 4 o'clock today, governor's announcement. I think everything I just gave you will probably need to have some kind of update, and we may do it by email tomorrow.
And Angie Bailey,
Sorry, Lyle.
No, we got a lot of good stuff coming in. Angie Bailey just put out a link on something on LinkedIn that's got some fascinating information in it. When we hang up, we lose these things, right? So we're going to capture them, and they'll be in our update that we send out to people. If you don't.
Yeah, and if anybody wants to save the chat, you can. I believe everybody can just write or do the little 3 buttons down by the chat and save it in a folder so that they have it right there. You have the ability to save the chat so you can look at it later.
Oh, good deal. I just was opening these links, and then there you got them on your computer, but that little button's a good idea too. Okay. How are we doing, Allison, Autumn? Well, we covered most of the people's comments. We've tried to catch them.
Yep, I think so.
All right. You want to drop the slides, and if anybody wants to just
Yes,
speak up and
sir.
say hello, we'd welcome them. This is where everybody gets
Yeah, I'll be
chicken
more
and
than
drops
happy
off.
to drop the slides.
I hope everybody caught the link for SHRM and HRCI. Okay. Any final comments or questions from anybody? We can take off the mute if anybody wants to speak up.
I have a question.
Yes, Mary Diane, this is my wife. What's up?
Hi. So if you play tennis somewhere, and I know that the people at the front desk are not vaccinated, and the boss is, but he's been afraid to ask or say. So now you are saying that if he knows that they are not vaccinated, he can require them legally to wear a mask inside. Is that correct? Very
He
specific.
could require him. He could require him to wear a mask. He's not required to require him to wear a mask, but
Okay.
he could, as a company, he could either require him to wear a mask. He could require them to get vaccinated, or any combination, because the DOJ has now said employers can require a mask. Employers can make sure that their employees are vaccinated, especially, or wear a mask, because they are, if they're in a public facing situation, they run the risk of, the employer runs the risk of his employees, his or her, exposing the guests, in this case, the people coming in to play tennis, to a known danger.
Okay, second
yes.
question. Can he require the guests to have proof of vaccination to be able to play there?
You know, that's a great question. And they have said that employers, if it's a private employer or a private business, they can either require or ignore that somebody has or has not been. Now, how do you prove that? I did have one. I had a bourbon distillery. We were doing a barrel selection, and I had a bourbon distillery that required proof of vaccination being presented, or you had to wear your mask and have a sticker on the whole time. I don't know that I would be careful in saying you won't allow the general public to come in at all because they're not vaccinated, but you could mandate that they have to wear masks if they are not vaccinated. That's how I would handle it. If he or she so chose, they could do that. I don't think I would say you can't play tennis here if people are paying membership dues because they're not vaccinated. I think that would go too far.
Okay. All right. Thank you.
You're welcome.
Thank you for speaking up. Other questions? Anybody?
Sister leg is a promising horse, 14 years old, little guy, small.
Jim, this is Christina.
Yes.
Do you see anything out in the future of them possibly extending the benefits that are being paid to those that are out with COVID or getting vaccines and stuff past September?
Yes, the $3.5 trillion package that is being talked about, not the $500 billion that's being passed right now by the Senate, or being debated right now by the Senate, but the $3.5 trillion package will probably include quite a bit more benefits. And if you're running a business right now, you probably already know, or if you're involved in HR, you probably already know the substantial difficulty in getting qualified people to work right now because they're on unemployment and they're getting the payments through September. Chances are that will be the next thing. They did not, at the end of July, for those that didn't know it, on Saturday night at midnight, the moratorium on evictions was lifted. So people can now be evicted from their homes for not paying rent. The landlords have gone 18 months with some of them not being paid at all, with no relief because they don't have employees, they didn't qualify for the PPP, et cetera. But they suddenly were allowed to do that. There was quite a bit of backlash from certain people in Congress because they couldn't believe that they didn't extend that one. So the chances of the September additional funds being lifted and terminating, I think there's no way that that will not be thrown out, that they won't extend it, because the backlash just from the moratorium on rentals was quite substantial. So stay tuned. I think by the end of August, you're going to hear something about extending federal unemployment benefits to $300. They'll probably raise it back up to $600 or even more. But the federal unemployment will undoubtedly be talked about in the next few weeks. And I'm sorry, not just the unemployment, because I know you were also talking about the EFMLEA. I suspect that too will be extended. You're going to have a huge problem right now because people are supposed to have their kids going back to school, and what if they can't? We're back into the same exact thing that Lyle and I and the whole teams all talked about last August when we were talking about returning to school. You could probably pull out the thing I presented last August 2 weeks in a row about how to handle return to work issues, because that's just about ready to explode again, because all of the people now, they've run out of their EFMLEA, they've run out of their extended benefits, they've run out of all of the COVID related, and now their kids are probably going to have to be homeschooled again. What do you do? And that's pretty much right where we are. I wish I had more definitive answer for you, but that's where it is.
Well, let me take a shift here. The back to work incentive that the governor gave, that application came up today, that employees that met those guidelines would be eligible to fill out. So what do you do if you have an employee that you hired, fulfilled all the requirements, and quit the day they fulfilled their 120 hours? Do I legally have to fill it out?
If they're over the amount, the answer is probably yes. That's one of the negatives to a program that gives an incentive for a specific but not continuing requirement. Now, the employer has to fill out all the paperwork, waste all the time doing it, and the person literally just wanted to get to the 120 hours so that they could get the benefit.
Which is exactly what they told employees when they walked out the door.
Yep.
Will I be in trouble if I don't do it?
You need legal guidance. That's what I'll tell you.
Oh, I'm
I
sure.
can't answer that.
I knew you couldn't. I was just curious. Thank you.
All right. Anything else, Jim? Let's wrap it up.
I think I'm good. I was just going to keep answering questions if people had them, Lyle, but I think we're good.
Good work. Well, thank you all for joining us. I guess we'll see what happens between now and Thursday. Let's see if we need to do another one of these. But in the meantime,
if we do, we'll let everybody know if we need to have one on Monday or a week from Monday, or just go back to normal, which I seriously doubt.
All right, everybody have a great week.
I don't think we're going back to normal. That's what I meant.
Yeah. Call us if you need us. Thank you, Jim, Autumn, Allison, Chase, Angie,